Good morning, everyone, and thank you for joining us for this third in our webinar series, Operating Safely in the Era of COVID-19, Personally, in Workplaces and Businesses. I want to thank Joss for moderating this session. So what I'm going to do is provide you an overview of what we're going to look at. We're going to look at some important updated facts and insights into SARS-CoV-2 and COVID-19 transmission spread and how we prevent it. I want to also relate these to specific practices at home, workplaces, and businesses. How we monitor, sanitize, decontaminate, and prevent. And we'll also look at considerations for effective risk management for COVID-19. So let me tell you a little bit about TSL. TSL is a 24-year-old company that's dedicated to the application of appropriate science and technology to support the productive sector in developing countries, particularly as regards improved sustainable competitiveness. Our clients are located in multiple countries in the Americas and elsewhere, and we cover a range of segments: manufacturing, exports, food service, agriculture, distribution, and hospitality. Our main focus is to provide the productive sector with the best available science to help them stay healthy, safe, and produce high quality, safe products and services for global markets. Now, the constant emergence of new and critical information about the novel coronavirus requires that the clients and the countries that we serve have timely, accurate, science-based, and trustworthy information, and that is the reason for this, our third webinar. So let's talk a little bit about the origins of the COVID-19 pandemic. As you know, it originated in China. It thought to originate in a wet market, which is where they sell animals. And it was thought to also have jumped from animals into human beings, which then had the adverse reaction, hence the COVID-19 disease. Now, the virus is called a coronavirus because it has these protrusions on the surface that gives it the appearance of a crown. These protrusions are what allows it to bind to cells and inject its genetic material into cells. I'm going to focus a little bit on some information you should already have. So you should know that COVID-19 affects people of all ages, young and old. And while it is more dangerous for persons with underlying conditions, it also affects healthy persons as well. Asymptomatic people, those who do not look sick or who are not sick, can also carry and spread SARS-CoV-2. The virus is spread by aerosols that come from our mouth and our noses when we talk or breathe, and also when we cough or sneeze. The virus has also been shown to survive on surfaces for varying periods of time, including surfaces like paper, cardboard, and plastic. We'll talk about this a little bit later. The COVID-19 pandemic, unfortunately, is going to be with us for the foreseeable future. And we will have to learn to live with it, just like we live with the flu or the cold every year, unfortunately. We will also have a resurgence of the infections after we get an initial subsidence of infections, because that is the nature of the illness. So we need to plan long-term to deal with COVID-19. Let's look at now some current scientifically supported facts about SARS-CoV-2 and COVID-19 that you need to be aware of. Now, in general, the approach to COVID-19 and the pandemic is based on information that is rapidly changing. And so because of the nature of the information, policy and implementation tends to lag the science. Unfortunately, it lags the science significantly. So while there are many examples of excellent and effective strategies to deal with SARS-CoV-2, many of the approaches that are being used are still acting on dated information and therefore are not as effective as they should be. What we're going to do today is update you on selected key facts that you should consider in approaching how you prevent and or manage the risk of COVID-19. Let's talk first about asymptomatic carriers. It is now established that the majority of transmission, that is community spread, is being done by asymptomatic persons, carriers. In reports from studies in Italy and also studies done in New York, and the New York study was with pregnant women, the percentage of asymptomatic COVID-19 positive persons was as high as 75 to 88%. Other studies suggest that the range may be about 44 to 55% or 50% on average. Doctors in Vo Eugenio in Italy found that 50 to 75% of the persons that tested positive for COVID-19 were asymptomatic carriers, and they stated that they represented a formidable source of contagion. This Italian study found that most of the asymptomatic persons were young and never developed symptoms. And I quote, "The percentage of persons infected, even if asymptomatic in the population, is very high and represents the majority of cases, particularly but not only among young people. Isolation of asymptomatics is essential for controlling the spread of the virus and the seriousness of the epidemic." I also quote, "Employing large-scale testing to find and isolate asymptomatic cases, particularly amongst health workers who may unwittingly pass the virus on to colleagues or patients, was a vital strategy in containing the spread of the virus and the seriousness of the epidemic." Now, this was one particular village in Italy that they had quarantined and were able to do a complete study on. So the findings are important. The doctors noted and they decided that they decided not to test doctors and nurses if they didn't develop symptoms. But in light of the results, this decision could be dangerous. Hospitals risk becoming zones with high infection rates in which infected people are not isolated, largely because they haven't been tested and they don't know they're infected, right? And so this same finding would also hold true for other workplaces as well. In fact, similar findings have been reported in multiple countries since then. It is important to note that the WHO had earlier, based on the findings originally in China, stated that asymptomatic infections does not appear to be a major driver of transmission. And this is the information on which most of the strategies today are based. However, current evidence does not support this. And this therefore represents a major uncontrolled risk and challenge for Caribbean countries that continue to focus on symptomatic cases only. This is also true for homes, workplaces, and businesses. I want to talk a little bit about airborne transmission. Now, this is what happened when somebody sneezes. You would have seen this before. Healthy persons can be infected by transmission of the virus by aerosols caused from a cough or a sneeze, such as we have seen, or talking, or just simply breathing in the room that you're in. All of these produce microscopic airborne particles, which have been shown to last in the air for up to 3 to 4 hours after they are produced. One study from NHK World in Japan shows them filling an entire room after just 20 seconds. And this is shown here with the red being the micro particles. So if you enter an elevator after an infected person, or you sit in an enclosed area for an extended period of time, you are at risk. The risk is going to be proportional to the actual amount of viral loads on those particles and the time you're exposed to. So just to clarify, while the novel coronavirus can be spread by fomites, which we'll talk about, airborne transmission is the most likely route of transmission. I want to talk a little bit about super spreaders. So in the cases we're going to look at these are examples of what happens when a super spreader of SARS-CoV-2 is allowed to contaminate public places or workplaces. And this is even worse when they're asymptomatic, meaning they don't know that they have COVID-19 and you don't know. So in the first case, if you look on the right, you see all the blue seats. This occurred in a call center in South Korea. It's from Park et al. 2020. And all of these workers were contaminated by a single co-worker coming in and out of their workspace over the period of a week. In the final analysis, about 85% of the persons were ended up coming down with COVID-19. In this example, this was a single person, labeled A1, in China, going out to a restaurant for an hour and a half. They spent an hour and a half in the restaurant, and 9 other persons came down COVID-19 positive, largely because of the air circulation from the air conditioner on the right during the period that they were in the room. Homes, workplaces, public transportation, social gatherings, and restaurants represent 90% of all super spreader transmission events. So in other words, enclosed areas are a particular risk and require special consideration. So we should think about how do we bring fresh air into these areas and how we manage circulation, how we enforce social distancing once we're in an enclosed area. Other examples of these high-risk events are religious ceremonies, workplaces, prisons, old people's homes. These are just some examples. You should be aware that in the US and Canada, there have been numerous, 115 to be exact, outbreaks of COVID-19 in meat and other plants involving 20 states and some provinces in Canada. Most people would be aware of the Alarica call center outbreak in Jamaica, and there have been other instances where workplaces have had to be shut down for COVID-19. And this includes the Ministry of Health in Jamaica. So these are just examples in the region that we need to be aware of and elsewhere. Last thing I'd like to talk about is fomite transmission. Now, fomites are objects or materials that are likely to carry infectious diseases. So for example, surfaces. You can get COVID-19 from touching these surfaces that have been contaminated with virus-containing droplets and then touching your mouth, nose, and eyes. These surfaces would be what we call the fomites. And this is an example. This slide provides information on how long SARS-CoV-2 survives on certain fomites. So for metal and paper, 5 days, glass and ceramic, 5 days, wood up to 4 days, plastics and stainless steel, 2 to 3 days, cardboard, like shipping cartons, 1 day, 24 hours, and then for metal, 2 to 8 hours generally. So we need to be aware of these when we are dealing with these kinds of surfaces. They therefore need to be effectively decontaminated, which means we must use cleaners and sanitizers that are effective against SARS-CoV-2, and not all are. So we need to be aware of which ones are. We recommend at TSL that you use hand sanitizers for hands that have a minimum of 70% alcohol, not 62 like many of them do. And we also suggest that you use other sanitizers, if not alcohol, like hypochlorite and those with other ingredients like hydrogen peroxide at 0.5% for hydrogen peroxide and 0.1% for hypochlorite, all of which have been shown to be effective against SARS-CoV-2. Now, despite the circumstances that I just mentioned, the new information or updated information, there are effective approaches that can limit the likelihood of COVID-19 spread within a workplace, a facility, or a home, despite the fact that there may be community spread. We will discuss some of these, mention them as we conclude. What are the implications of all of this? Firstly, the current measures that are being used in general are not sufficient. They don't effectively prevent the likely contamination or infection of persons in a particular household, in a particular workplace or business. Secondly, prevention of a spreader or super spreaders entering a home or a facility is the best way to limit risk. Talking, breathing, coughing, singing by spreaders is a major concern. Screening of persons entering a facility is critical, and this must be done, but it must be done effectively. Some of the approaches being used are not the most effective. Identification of carriers, particularly asymptomatic carriers, is critical to long-term effective management of the risk of the disease, and enclosed spaces put persons at the greatest possible risk and need to be carefully considered. At TSL, we recommend that all staff wear masks and, if possible, wear gloves if they're working in any environment, and that when you go out in public or are in the presence of other people, you do the same as well. This is an example of one effort by a company to protect its staff. However, because the protecting shields are not rigid, they are not as effective as they would like. Permanent effective shields like this are likely to be more practical and more durable and more effective. Other implications. It is absolutely critical to have effective disinfection of surfaces. When we are screening, we need to look not only for traditional symptoms, as this is not the best way to identify risk. As we have said, many people are asymptomatic. Unfortunately, COVID-19 affects all ages, so everybody is at risk, not just older people. So even young, healthy people are at risk. Now, antibody testing, which you might have been hearing a lot about, is a quick way of screening, and it's a quick, effective screening test. However, positive results need to be confirmed by an accurate polymerase chain reaction or PCR-based test. Now, there's a rapid 5 to 15 minute PCR test that's being sold by Abbott, which you've also heard a lot about. This is only good for screening because it has too high a false and negative rate. So it can't be used as a final test. You need to use a PCR test, a standard PCR test that is accurate to determine whether or not people are likely to be positive, definitively. All of this and all we've discussed should highlight the last point, which is that the WHO and CDC, the advice from these entities, tend to lag the facts and the science, which the practitioners are constantly publishing. And so we need to stay up to date with what is constantly being published. So in closing, we want to look at some recommendations. Firstly, airflow and the exchange of fresh air in a building and in any home or in any office location is important. This has implications for future design of buildings where fresh airflow through the building or room is desirable. Whether this is achieved by a fan in conjunction with an air conditioning unit is up to you. For meetings, keep them short. Wear masks and have short intervention by speakers if it is at all necessary to have an in-person meeting. Keep it to decisions and critical information only. If possible, do it by virtual means as we are doing this webinar. It is important that you verify that the airflow in a building, in rooms, is adequate and the quality of the air is also adequate. This needs to be done periodically if possible. Complete and thorough testing of your environment periodically is going to be required to guarantee safety. This can be done by a combination of a screening test or antibody test or the Abbott type PCR test but you will need a PCR-based, the standard PCR-based test for a definitive diagnosis. Now, this is both the environment that you're in and all of the staff, all of the people in the household, if you're talking about a household, in a home or in an office setting. Because if you don't constantly know, then there's a likelihood that somebody will come in, and as you've seen with the super spreaders, contaminate everybody else unintentionally. Face shields, in addition to masks and gloves, are something that businesses and workplaces ought to consider, particularly for people who are dealing with customers or who are likely also to be at risk. And we recommend that all, if you're talking about a manufacturing entity, all post-production staff should wear face shields in addition to masks and gloves. Critically, you don't want persons wearing street clothes, clothes that have worn outside, into the facility or on property or into your home. These should be left in a controlled area and washed and sanitized either on property or by someone who is certified or verifiable as being effective in their cleaning and sanitation of these clothes. You want to have a shoe protocol, whether private homes, hotels, plants, or other facilities. You don't want shoes that have been worn outside being worn inside the property, because those would also be able to bring fomites in, bring the contamination into the home or facility. Hand washing facilities should be adequate, and these should be provided near to the areas where staff are working. You want staff to wash their hands, preferably every 2 hours, and you want to also be able to trace back to the last wash. So that means for businesses that operate high touch or production facilities, or even hotels and food service operations, you want documentation that allows you to trace back to the last time staff washed their hands. Effective sanitation is the final point on this slide. This must be documented, and you also want to verify the effectiveness of your routine cleaning. You want to do this on some kind of a basis. Many people do a lot of cleaning. At TSL, we do a lot of sanitation verification, and many of our clients will tell you that from time to time they find that the cleaning is not as effective as they thought, and that's the purpose they do the verification. So this is important, however you do it, with rapid kits or otherwise. Final recommendation we want to give you is that you do ensure that your entire staff is properly trained and understand the nature of SARS-CoV-2, how it is transmitted, and how spread can be prevented. Don't ignore the social distancing guidelines or the use of PPE, personal protective equipment, in your facility, because these could put you and your facility, your home or other facility, at risk. We want to thank you for having joined us on this webinar. And I had indicated that we are certain that these things can be dealt with. At TSL, we've pulled all the scientific information together, and we've developed 2 specific solutions for COVID-19. One is called TSL RAC, which is a rapid assessment for COVID-19, and TSL CARE, which is a COVID-19 assessment and response program that allows you to implement a very comprehensive program for COVID-19 prevention. Thank you for joining us. We like to think that TSL is the science supporting your business and the science supporting your health. We have this book that just came out, by the way, that's for those people in food. Excellent information on manufacturing, exports, and the technical requirements. So now I want to close. I want to thank you for participating. You can get a lot of information from our website. We'll put up all of the webinars there. But I want to turn over to Jocelyn, who will manage the question and answer session. Thank you very much.